Hello guys, welcome to Med Flash. Ultra high yield obstetrics one-liners. Earliest hormone detected in pregnancy, beta HCG. Earliest ultrasound sign, gestational sac. Most reliable sign of pregnancy, fetal cardiac activity. Normal pregnancy duration 40 weeks. Term pregnancy 37 to 42 weeks. Next topic, ectopic pregnancy. Most common site of ectopic pregnancy, ampulla. Most common risk factor, pelvic inflammatory disease. Medical treatment drug for ectopic pregnancy, methotrexate. Beta HCG level for methotrexate eligibility less than 5,000 international units per liter. Ruptured ectopic pregnancy, emergency surgery. Hypertensive disorders. Diagnostic blood pressure for preeclampsia greater than or equal to 140 by 90 mmHg. Severe preeclampsia blood pressure greater than or equal to 160 by 110 millimeter mercury. Drug to prevent seizures, magnesium sulfate. Definitive treatment for hypertensive disorders, delivery. Severe complications of hypertensive disorder in pregnancy, HELP syndrome. Next topic, placental disorders. Painless bleeding in pregnancy, placenta previa. Painful bleeding in pregnancy, placental abruption. Placenta previa diagnosis via ultrasound. Vaginal exam contraindicated in placenta previa. Hypertension is major risk factor for placental abruption. Postpartum hemorrhage. Most common cause of postpartum hemorrhage, uterine atony. First line drug for postpartum hemorrhage, oxytocin. Causes of postpartum hemorrhage, 4 T's. Tone, trauma, tissue, thrombin. Surgical treatment for postpartum hemorrhage is B-Lynch suture. Severe complications of postpartum hemorrhage, hypovolemic shock. Amniotic fluid disorder. If a patient has low amniotic fluid, it's called oligohydramnios. AFI for oligohydramnios less than 5 cm. High amniotic fluid, polyhydramnios. AFI for polyhydramnios greater than 25 cm. Maternal diabetes commonly causes polyhydramnios. Labor. Labor monitoring chart is called partograph. Longest stage of labor, first stage. Most common fetal presentation is vertex. Most common malpresentation, breech. Most common cause of obstructed labor is called cephalopelvic disproportion. Twin pregnancy. Most common twin type is dichorionic diamniotic twins. Complication of monochorionic twins is called twin-to-twin transfusion syndrome. Monozygotic twins arise from single fertilized ovum. Dizygotic twins arise from two ova. Preterm birth common in twin pregnancy. Amenorrhea. Absence of menstruation is called amenorrhea. Primary amenorrhea definition is called no menses by 15 years. Most common cause of secondary amenorrhea is pregnancy. Most common pathological cause, PCOS. Polycystic ovarian syndrome. Progesterone challenge test indicates ovulation. PCOS. Full form, polycystic ovary syndrome. Diagnostic criteria for PCOS is Rotterdam criteria. USG appearance of PCOS is string of pearls. Infertility drug of choice for PCOS is letrozole. PCOS associated with insulin resistance. Endometriosis. Presence of endometrial tissue outside the uterus is called endometriosis. Most common site, ovary. Gold standard diagnosis laparoscopy. Ovarian cyst name called chocolate cyst. Classical symptoms of endometriosis, dysmenorrhea, dyspareunia, and infertility. Fibroid. Most common benign uterine tumor is called uterine fibroid. Most common type of fibroid is called intramural. Most symptomatic type is called submucosal. Hormone dependent estrogen. Surgical treatment of fibroid is myomectomy. Cervical cancer. Cause of cervical cancer is human papilloma virus infection. High risk HPV types are 16 and 18. Screening test for cervical cancer is pap smear. Most common histological type squamous cell carcinoma. Prevented by HPV vaccination. Ovarian tumors. Most common ovarian tumor serous cystadenoma. Most common malignant ovarian tumor serous cystadenocarcinoma. Most common germ cell tumor dermoid cyst. Tumor marker of dysgerminoma is LDH. Tumor marker yolk sac tumor AFP. Pelvic inflammatory disease. Infection of female reproductive organs are called pelvic inflammatory disease. Most common organism cause pelvic inflammatory disease is chlamydia trachomatis. Major complication of PID is infertility. Severe complication of PID is tubo-ovarian abscess. Diagnosis mainly by clinical symptoms. Contraception. Long-term IUCD is called copper T380A. Duration of copper T380A is 10 years. Emergency contraception drug is levonorgestrel. Barrier method of contraception is condom. Permanent female sterilization is called tubectomy. Infertility. Failure to conceive after 1 year. First investigation in the case of infertility is semen analysis. Tubal patency test is hysterosalpingography. Assisted reproductive technique is in vitro fertilization. Ovulation induction drug is letrozole. Other high yield facts. Most common cause of abnormal uterine bleeding in adolescents and ovulatory cycles. Most common site of endometriosis is ovary. Most common benign ovarian tumor serous cystadenoma. Most common malignant ovarian tumor serous cystadenocarcinoma. Most common cause of pelvic pain in reproductive age is called endometriosis. Most common cause of postpartum hemorrhage, uterine atony. Most common cause of infertility in women, ovulatory disorder. Most common ovarian germ cell tumor, dermoid cyst. Most common cervical cancer type, squamous cell carcinoma. Most common complication of PID, infertility. Hormone in most oral contraceptive pills is estrogen plus progesterone. Most common side effect of OCP is nausea. Absolute contraindication for OCP, thromboembolism. Postcoital contraception time limit 72 hours. Copper T mechanism, spermicidal inflammatory reaction. Pelvic organ prolapse. Descent of bladder into vagina called cystocele. Descent of rectum into vagina called rectocele. Descent of uterus called uterine prolapse. Conservative treatment for pelvic organ prolapse is pessary. Exercise used in prolapse treatment is Kegel exercise. Organism causing genital warts are HPV 6 and 11. Painful genital ulcer disease called chancroid. Painless genital ulcer or syphilis. Strawberry cervix seen in trichomoniasis. Cottage cyst discharge seen in candida infection. Most common germ cell tumor called dermoid cyst. Another name of dermoid cyst mesoteratoma. Tumor marker for granulosa cell tumor inhibin. Tumor marker for epithelial ovarian cancer is CA125. Bilateral ovarian tumors commonly seen in Krukenberg tumor. Cancer of uterine lining called endometrial cancer. Most common risk factor of endometrial cancer is unopposed estrogen. Common symptom postmenopausal bleeding. Diagnostic test for endometrial disorder or postmenopausal bleeding is endometrial biopsy. Most common histological type is endometrioid carcinoma. Absence of uterus and vagina in MRKH syndrome. Uterine anomaly with two hands, bicornuate uterus. Failure of fusion of Mullerian duct causes uterine anomalies. Imperforate hymen presents with primary amenorrhea. Blood collection in vagina due to obstruction, hematocolpus. Failure to conceive after regular intercourse for 1 year is called infertility. Most common female cause of infertility is ovulatory disorder. Most common male cause in infertility is low sperm count. Test for tubal patency is hysterosalpingography. Assisted reproduction technique is in vitro fertilization. Most common benign ovarian tumor, serous cystadenoma, and most common malignant ovarian tumor is serous adenocarcinoma. Most common benign uterine tumor is uterine fibroid. Most common cause of secondary amenorrhea is pregnancy. Most common complication of PID is infertility. Most common cause of pelvic pain in reproductive age endometriosis. Hormone responsible for ovulation LH surge. Hormone maintaining pregnancy is progesterone. Most common cervical cancer type is squamous cell carcinoma. Screening test for cervical cancer is pap smear. Most common ovarian germ cell tumor is dermoid cyst. Ovulation induction drug of choice in PCOS infertility is letrozole. Gold standard diagnosis for endometriosis is laparoscopy. Most common cause of abnormal uterine bleeding in adolescents and ovulatory cycles. Most common site of ectopic pregnancy is ampulla of fallopian tube. Most common cause of postpartum hemorrhage is uterine atony. Gold standard for diagnosing endometriosis is laparoscopy. Most common benign tumor of uterus is uterine fibroid is also known as leiomyoma. Most common cause of secondary amenorrhea disease is pregnancy. Screening test for cervical cancer is pap smear. Diagnostic criteria for preeclampsia is greater than or equal to 140/90 plus proteinuria. Drug used for seizure prophylaxis in eclampsia is magnesium sulfate. Most common organism causing pelvic inflammatory disease is chlamydia trachomatis. Most common symptom of endometriosis is dysmenorrhea. Diagnostic test for gestational diabetes in India is BIPSI guidelines 75 gram OGTT. Most common type of fibroid disease is intramural fibroid. Investigation to assess fetal well-being is non-stress test. Chart used to monitor labor progress is partograph. Tumor marker for dysgerminoma is LDH. Most common cause of primary amenorrhea is gonadal dysgenesis in Turner syndrome. Long-term IUCD used for contraception is Carpati 380A. Its duration is 10 years.